My name is Philip Stringfield, Specialist of Health Center Operations Training here at NAC, and I want to welcome you all to our NAC Telehealth office hours. And then as we just experienced, I want to make sure that we please make sure your audio is muted in order to hear our presentation and our presenters today. We definitely want to make sure we limit any interruptions as possible. So just make sure that your audio is unmuted. And of course, when there is time at the end, if you would like to speak a question at the end of the presentation, you can definitely do so by unmuting your mic. And then if you are experiencing issues, feel free to send me an email. I have my email at the bottom of this this slide right here, pstringfield@nac.org. But essentially, if you do have issues with your audio, feel free to disconnect your audio and then reconnect. And you can always X out of the meeting and open it back up again. That should also get you some success with accessing today's presentation. And pretty much, as you know, we'll be using the chat box to get all of the questions answered that you have. So make sure that as you are listening in to just put any of your questions in the chat box that's located to the right of your screen. And before we get started today, I really wanted to put in a plug for some of our upcoming operations, trainings, and technical assistance events that we have coming up and available for you. So first would be the two-part coding and documentation series. And if you haven't seen this yet, it does start next Tuesday and end right at the end of the month. But we'll be using the Association for Rural Health Coding Professionals to assist us throughout this process, but really looking at some of your evaluation and management changes for your community health reporting. And part two is going to be looking at treating substance and opioid use disorders via medication-assisted treatment. So that is available on our website. And as we're going through our presentation today, I'll make sure to put a link into the chat so that way you can access it as well. In addition, for our operations folks, we do have the Practical Art of Health Center Operations virtual training happening at the end of next month. And if you have been a previous attendee, maybe in person or virtual last year during 2020, these are really a set of 3 series trainings that will help you get your operations really in order and looking at some strategies and techniques that can really help move the needle. It looks like it says that class on the 19th is stating is full. I'm definitely going to go ahead. I'll check in with our team just to see if the registration was at a max or if we can open that up further. So thank you for putting that comment in, Tony. And then lastly, I put it in a plug last month, but also just wanted to keep you all posted. We do support 5 EHRs and have EHR user groups for each of them. They are Athena One, Athena Flow, and Athena Practice, eClinical Works, Greenway Energy, and NextGen Healthcare. So if you would like to be a part of that community, definitely feel free to send me an email. Some of those groups meet monthly on a monthly basis, and some meet on a quarterly basis. But right now, we're focusing on vaccine management and, of course, the upcoming UDS report. So if any of that information sounds of a good appetite for you, definitely feel free to email me, and I'll get you connected to the right group, and you can sign that up to receive future updates from the group itself. And I see we got a link to the Practical Art of Health Center Operations training in the chat box. So thank you. And just the last update, if you were not with us last month, we featured the National Healthcare for the Homeless Council in addition to Care for the Homeless in New York, as they talked about caring for vulnerable populations throughout COVID-19. So if you have not been able to, definitely make sure you take a look back at the telehealth page, or you can go to the clearinghouse where the recording is stored. There was a lot of great best practices that they're using, and in addition, some foresight to what they're planning on doing in the future. So definitely want to highlight them and make sure that you get access to that recording. And for today, we'll be hearing telehealth policy updates from 2 of my NAC colleagues, Susan Sumrell and Pauline Jamry. So with that, really just wanted to before we hand it over to them, just let you know that you can always put in your questions in the chat box. This will definitely help as we go throughout today. If you do have a more specific question, would like to understand a little bit more on what policy sides are going through with telehealth, I definitely put those in so we can get those answered for you. We definitely have the right folks on the call. So I'm gonna just pause really quick and see if I can locate Pauline. I see Pauline. So I'm going to go ahead and hand things over to Pauline, and I'm gonna unmute you now, okay?
Hello,
Pauline.
everyone. Can
Awesome.
everyone hear me?
Yes, thank you so
Could
much.
everyone mute themselves? I hear a lot of echoes. Awesome. Thank you so much. Thank you all for having me today. And I do not have slides prepared. I apologize, but I do have a 2-pager Microsoft document that I can share with Philip at the end of this, and he can get it out to you all. So I hope that works for everyone, just to gather my notes. And also, you can follow up with any questions about it to me at the end of this and after you get the document. So I'm going to kind of go over what telehealth looked like during COVID-19, and also at least on the congressional end, and then also moving into telehealth and NAC's asks to Congress and to HHS in the 117th Congress and beyond. And then I will just have some concluding thoughts for you. All right, so let's start with March of last year. As we all know, the CARES Act passed, and in the CARES Act there was extension of telehealth and reimbursement for it. Basically, it gave health centers limited reimbursement for providing telehealth services to Medicare patients in their homes. However, the rates are insufficient, and they still are. Then there was an effort to push the House HEROES Act and the Senate HEALS Act, and that was about May through July of last year. Neither of those passed into law. However, the House did pass the HEROES Act. The House had a bunch of stuff in there for telehealth. I put in some summaries in there, however, and broadband issues. However, it's too many to go over, but I did put a link in this document for you guys. A lot of it still did not address what the health centers needed, but it did have a lot of broadband issues as well. The HEROES Act, however, was extremely unlikely to pass in the Senate because it was a Republican-controlled Senate. So the Senate introduced on the heels of that, they introduced the HEALS Act, which included provisions to extend the time for which health centers and rural health clinics can serve as distant sites, and Medicare from the duration of the public health emergency to 5 years following the end of the public health emergency. The bill would also remove the geographical restrictions for originating sites. This provision, unfortunately, would not increase the payment for these telehealth services to the Medicare PPS rate or equal to an in-person visit, which was one of the issues I said was a problem in the CARES Act. Therefore, I'm sorry, let me backtrack a little bit. The HEALS Act didn't go anywhere. It didn't even pass the Senate. But NAC did work both with the House and in the Senate to get some of these provisions in the HEROES Act and the HEALS Act. So basically after that, NAC worked on several pieces of legislation, several letters in Congress, and several efforts in general to correct some of these provisions as stated by the health centers. So one of these was, and this is not an exhaustive list, but this is certainly something that we focused our efforts on. The first was HR 7187, the Helping Ensure Access to Local Telehealth Act, so the Health Act of 2020, and it was led by G.T. Thompson and G.K. Butterfield. This allowed permanently FQHCs and rural health clinics the ability to provide telehealth services in Medicare as distant sites and to be paid equally in an otherwise in-person visit or the Medicare PPS rate. The bill also removed the geographic restrictions related to originating sites. Another bill was the Improving Telehealth for Underserved Communities Act of 2020, led by Adrian Smith and Tom O'Halloran. So that's a bipartisan bill. And Senators Cindy Hyde-Smith and Angus King making a bipartisan bicameral bill, which is great. The bill would allow for Medicare telehealth services provided by FQHCs and RHCs to be paid what they otherwise would for a visit furnished in person. The language also allows for the payment for the duration of the public health emergency, and we'll circle back to that as well. Kind of one last bill, or one of the last two bills, was HR 7663, the Protecting Access to Post-COVID-19 Telehealth Act, led by Mike Thompson and some others, a bipartisan House bill. It would again permanently allow FQHCs and rural health clinics the ability to provide telehealth services in Medicare as distance sites and to be paid equal to an otherwise in-person visit or the Medicare PPS rate. The bill also removed the geographic restrictions related to originating sites. In the end, we ended up coalescing around a bill called the Creating Opportunities Now for Necessary and Effective Care Technologies, the Connect for Health Act. The reason why we did that is because that bill had the most momentum at the time of getting into the COVID stimulus package that did get signed into law by President Trump on December 27th, 2020. So it's not that those other bills weren't great. It's just this was the one that had the most support by the most Congress members. So we supported it as well in hopes that it would be included in this COVID package. It was not. But this one also had allowed the FQHCs and rural health clinics to be approved as distance sites and included removing geographic restrictions on accessing care from the home. All right, so let me pause there, and then I will go back and say also in the previous Congress, we also worked on some letters regarding telehealth. One of those letters was by Abigail Spanberger and Dusty Johnson, which included adding additional funds to the FCC COVID-19 telehealth program that was created in the CARES Act. The initial $200 million in funding for this program was exhausted in July of 2020, with many health centers receiving grants, while others that applied did not receive funding. They wrote a letter to the FCC commissioner about this, and then later they also introduced HR 7660, the COVID-19 Telehealth Program Expansion Act, which would allocate an additional $200 million for this program. That also did not go anywhere as a bill. Also, NAC supported and worked with a letter by Representative Small and Representative Huffman to CMS to allow for FQHCs to receive payment for providing audio-only Medicare telehealth services. That also didn't go anywhere, but it was certainly a great effort. In the actual past COVID stimulus package, HR 33, that I mentioned was passed December 27th of last year. It extended the current CARES Act telehealth provisions, but they are still currently tied to the public health emergency extensions, which must occur every 90 days as determined by the health secretary. This bill also provided for more funding for the FCC COVID-19 telehealth program, approximately $250 million. So it did not include a lot of these provisions that NAC was looking for and health centers were looking for in telehealth. So our ask to Congress in our December 5th letter, when we were pushing very hard on this COVID stimulus 19 package, was for crucial extension, expansion, and reimbursement reform of telehealth coverage and services. Currently, 95% of health centers are using telehealth for their patients. The CARES Act provided for health centers with limited reimbursement for providing telehealth services to Medicare patients. However, the rates are insufficient to cover costs. We need statutory changes to ensure that payment is adequate and consistent. Furthermore, these services all end when the public health emergency is declared over, cutting patients off from this care. Therefore, federal qualified health centers must have permanent status as distant site telehealth providers. And then we also endorse that Connect Act, like I mentioned before. However, it did not get included in HR 133 or any of the COVID packages that moved forward in last year. So in our ask, we also requested permanent expansion of the definition of telecommunications platforms for telehealth to include an audio-only modality for clinically appropriate services, reimbursed at a rate comparable to other telehealth reimbursement, which is critical for our patients who lack broadband access and face-to-face barriers in person. So to recap, lots of flurry of activity, lots of different efforts around telehealth and what we need fixed for health centers. However, only the CARES Act and the COVID stimulus package passed. Therefore, it's still tied to the public health emergency. The rates are still low. Reimbursement rates are still low. Audio only is not covered. And we still don't have the distant site, and the geographic restrictions are still there. All right, with that, I will say this list again is not exhaustive. There are certainly other bills, letters, etc., that NAC has worked with Congress and HHS on re-telehealth, including comments to HHS, and I know Susan knows a lot more about that than I do. And moving forward, NAC will continue to work with Congress and HHS on telehealth. So not all the bills addressed everything we wanted. So we will certainly advocate for that, those items I discussed, and we'll certainly advocate for more funding, i.e. FCC funding increases. And we'll also work with you, the health centers, to advocate for the nuanced help you all need in regards to telehealth. So I will end there, and then Philip, if you wanted me to answer any questions in the chat, since I was presenting, I didn't see any, or however you wanted to do that one.
Yeah. Thank you so much, Pauline. I really appreciate that run through. And for those who are on the line, I will be sure to share the 2-pager with you as soon as the call ends. But we did receive a couple of questions. One, I believe you did touch base on, but it was a question around the Connect Act. It says, is there a 1-pager on the Connect Act, and did it pass?
Oh, I have feedback again. I'm sorry.
Oh, it's me. Sorry.
Sure. No, we don't have a 1-pager on the Connect Act, since it was we coalesced around it at the last minute. But certainly if you Google it, there's a lot out there about it. But I can certainly send you what I have, which is in the 2-pager about it. And and it did not pass, no, unfortunately. But it was bipartisan, bicameral, and it did address some of the needs of health centers for it. So we're hoping we don't know if it will be reintroduced this year. We're guessing certainly some version of it will certainly be reintroduced this year, and work with them on getting some of those fixes as well.
Awesome. Thank you so much. The next question is around e-prescribing. It says, are there any updates or additional information around e-prescribing controlled substances via telehealth?
Sorry, I thought I was on mute. I personally do not have that information. I do know that mental health folks can do that via telehealth. But in terms of that particular piece, I'm sorry, I would have to refer you maybe to Susan or to perhaps Gina Capra. But personally, in terms of what I've heard on the Hill, that has not come up. So sorry about that.
No worries. Thank you so much. And we'll be hearing from Susan next, in case she wants to add on to any of these. And then just scanning through the last question we have for Pauline. So thank you. It says, any chance to move CMS towards better RPM recognition / reimbursement?
And then she said her question is probably a Susan one. And I would have to agree because I'm not sure. But Helen has been great on telehealth. So if she wants to chime in on anything, please let us know. And yeah, I will certainly, Phil, get that to you right now. The 2-pager, it was just so dense and hard to break down. I just wanted everyone to have everything, all the information. So, and then Matt Logalboo answered, I think, as well. But yeah, I'll stop there and thank you all so much. And I appreciate it. And I will get that information to Philip right now. Thank you.
Thank you so much, Pauline, for your time and sharing that great information with us, everything that's going on the Hill. So right now we're going to go ahead and transition over to Susan Sumrall, Deputy Director of Regulatory Affairs. And I do have a couple of slides as well. So I'm going to go ahead and advance, and I'll mute myself now.
Awesome, thanks. Can everybody hear me okay? Perfect, okay, I saw a thumbs up, so we're good to go. I want to just add to what Pauline said. I mean, there's been a lot of really great activity up on the Hill, and I know everybody is sort of anxiously waiting for some action to make a lot of this, these telehealth provisions permanent. And I think Pauline summed it up really nicely with her comment about, is the Connect Act, is it back this Congress? I don't think it's going away. I think it's just we've got to get through a couple of things and see what happens next. But I definitely think this is still on folks' radar, as I know it is on your radar as well. And then I'm going to, before I talk a little bit about what the states have been doing, I am going to go ahead and answer Helen's question. She answered it in her chat as well, the question about any chance to move CMS towards better remote patient monitoring, recognition, and reimbursement. I think it's on the list of things. I think we also need to sort of get over some of these more traditional telehealth hurdles, making those things permanent. But I do know that there is a call for that, and something that we have also advocated for in the past as well. So it's on the list. I wish I had a crystal ball to tell you what was going to happen with that, but at this point, I'm not exactly sure, but we'll continue to keep advocating for it. I want to talk just for a little bit, and if you've heard me talk in the past, you've probably heard similar comments about sort of where states are right now and what it looks like, specifically in the Medicaid program on telehealth. There, as Pauline mentioned, a lot of activity on the Medicare side, also similar activity on the Medicaid side. And just for folks, if you're not sort of eating, breathing, sleeping Medicare and Medicaid, on the Medicare side, we do need Congress to act on that. It requires a change in statute, which is why Pauline went through all those bills to understand exactly what the law needs to say specific things for CMS to be able to act on the Medicare telehealth side. On the Medicaid telehealth side, though, it's a little bit of a different story. CMS has given states sort of broad authority to sort of create their own telehealth program and however they best see fit. And that authority actually existed prior to COVID. And we saw probably more than a handful, a little bit more than a handful of states really pursued that and had put telehealth programs in place. They may not have been the most robust, or they may or may not have included health centers. Some states did. Maybe there were some different limitations, but states were definitely sort of starting to dabble in telehealth before COVID hit. But then obviously, much like what happened in Medicare, as soon as COVID hit, you all know this much better than we do, telehealth became a top priority for a lot of folks. In March 2020, CMS right away went out and said, go for it, please, like you have this flexibility, please use it as you see fit. You know, we'll help you sort of fast track things if you need to. And when they were talking not just about telehealth, which is, when we say that, we mean sort of audio visual services. So much like this, communicating with your provider via some sort of platform where you can both see and hear the provider and the patient. But they also noted the use of audio-only services. And Pauline talked about audio-only services on the Medicare side as well. And we're hearing and have heard and would love to continue to hear from you all about the importance of those audio-only services as we continue to push for that, both at the congressional level and then at the CMS and then you guys at the state level. So CMS came out and they said, go for it. You should definitely use these services. We'll help you get that done. And we did see, in some way, shape, or form, all 50 states, the District of Columbia and Puerto Rico expanded their telehealth policies through the public health emergency. They used that emergency and said, we will definitely look at this and want to use it. The majority of states, in the majority of states, health centers were reimbursed at either their PPS or APM rate, or what they would be paid in person. We actually saw, I mentioned that there were some states that had telehealth policies in place prior to the pandemic, and maybe those were not being paid at the PPS or APM level. We saw those states bump their rates up as well to say, okay, we understand we need to be paying in person during these really trying times, for the same as we'd be paying in person during these really trying times. But that was not a consistent policy across the states. Again, because CMS gives states broad authority to do this, there is a lot of variation. And I think even within a state, there is some variation. Sometimes health centers are, as I said, included. Maybe they can be an originating site. Maybe they can be a distant site. Maybe they can be both. What is the payment? Are they being paid at the fee schedule, whatever that might be in the state, or are they being paid their PPS and APM rate? There's a lot of variation and a lot of flexibility that the states have. So looking at this and moving forward and thinking, what does this actually look like? How do we take this and make these policies more permanent? I think you really need to think about how you've used it and where you think using it, like what will continue post-pandemic. You really need to sort of think about making the case, and Pauline laid a lot of this out as we were talking about letters and really communicating with Congress about the importance of this, thinking about the importance of being paid the same that you would be paid in person and making that case for folks. We do know that some states have started in the process to make these policies permanent. Some states are pursuing state legislation. We know Colorado passed legislation. I believe Ohio did. Wisconsin actually did prior to the pandemic, had a sweeping telehealth policy or bill put into place just prior to the pandemic, which I imagine was probably helpful as they worked through this over the last several months. So there are states that have already taken those steps, and then there are several states that are currently working on legislation right now, and hopefully we'll see that passed during their session coming through. The other thing too is because states had this broad authority, they may or may not want to pass legislation to do it. It may not be something that your state legislature takes up, but it might be something that you can work on directly with your Medicaid agency through the state plan amendment process and working through. So there are a couple of different avenues that you can use and pursue if your state is looking at making these policies more permanent, and really ensuring that you're talking about the importance of being paid the same as you would be for in-person visits, be that PPS or APM, and talking about the types of services that you're using, thinking about those audio-only services as well, and you're able to tell that story. Philip, I think I have one more slide. Is that right? You can go ahead and go to the next one. So just thinking about COVID and beyond, a couple of these things I've already mentioned. States are looking at it in a variety of different ways. And then the biggest thing I really want to just harp on quite a bit is are FQHCs included? I had the pleasure of going through all 50 states and looking to see what their telehealth policies are. And sometimes the language is very specific, and it says, you know, this type of provider, that type of provider, and for FQHCs, they will be reimbursed at their PPS or APM rate. Other times, the states, because I think they were all just having to move very quickly, went and said, we're just covering telehealth for everybody, and it's paid the same as it would be in person. And I think when you're looking at it and when you're looking at making these things permanent, you really do want to think about being more specific, just to really be sure you can check that box that it is for FQHCs and it does allow for that PPS or APM rate for those services. And again, what type of services? Are we talking audiovisual or are we talking audio only? We are helping states, and we've put together a toolkit, which I can include in the chat box, that goes into a little bit more detail about all of the legal and regulatory language, and looking at state plan amendments and looking at model legislation and sort of a timeline of where we are and some resources for you. I can include that as well. It goes into just more detail than what I've covered here today. But I am going to pause there and see if there are any other questions that have come in.
Thank you, Susan. We actually had two good questions. The first one's around E&M codes, and I know we don't have our finance specialist here, but I wanted to just pose it to you and Pauline in case there was any additional insights. And then, of course, anyone in the group, if you have any information, you can always also put it in the chat as well. But this question from Matt, it says, some of our peer orgs are using standard E&M codes, for example, 99212-5 for video visits. Others are using online digital evaluation codes, 99421 through 99423. Has there been any guidance on a best practice for this?
Philip, I would really refer that back to the training and technical assistance folks, just to be sure we got it right. I don't know, or if there's anybody on the call that had some thoughts on that as well, I'd be interested to hear. I don't know, Pauline,
Definitely.
if you feel the same.
I do too. That's why I said with that other question earlier regarding controlled substances, exactly, that's why I said Gina, she's as head of TTA. So I agree with you on that, Susan. Thanks.
Perfect. So with me being in TTA, I will definitely make sure to pass these questions along to our team members. I do have your email as long as you entered it as a registrant for today's call. So any insights, I'll definitely make sure to get you some feedback. And then, of course, you can always email telehealth@nac.org directly to get those questions asked. And then, you know, I'll definitely make sure to follow up with you with some insights. The next question was really good. It was something that I was thinking about asking as well. So the question goes, what does the foreseeable policy landscape look like with congressional changes and new administration?
Sure. Ooh, I'm still getting.
Oh, it's me. I'm sorry.
It's okay. So it looks more positive, I think, with a slim majority in the Senate and a slim majority in the House. I do know that there are some concerns around how budgetary wise, especially around the audio only piece, how that would affect Medicare reimbursement rates, as well as Medicaid. So there would certainly have to be some balancing of budgets there, and sequestration is coming back as well. So there's some pay-go categories we would have to work out. But I certainly think that getting some of these telehealth priorities through, especially since they were championed more by Democrats than Republicans on the Hill, it is positive. However, that does not mean that with this first stimulus package that Joe Biden has mentioned, he's thrown out a $2 trillion stimulus package he would like to push through in the next couple months. I mean, we don't even know if he can get that passed in the House or Senate, so they might have to go to budget reconciliation, which I mentioned some of those pay-go forms. It basically has to basically the bill has to equal zero. The cost of the bill has to equal zero. So it's sometimes very hard to get that done. So I think we could get certainly some of our telehealth provisions in some of these packages moving forward. I'm not saying it will be the one right off the gate, but I think the landscape for bitter partisan divide is looking a lot better with a triple sweep of the presidency, the House, and the Senate.
Awesome. Thank you, Pauline. And thanks to everyone asking these great questions. We really have a good group of folks. I think this next one's going to be for you, Susan. It says, I have been looking through various state telemedicine bills. Are you aware of any state that has successfully passed quote unquote permanent legislation that includes audio only?
So both Colorado and Ohio have done that. And then I included a link to this resource guide in the chat, actually just above your question, I see. And we have model legislation in there as well that includes reference to audio-only services. So that would be something to consider and might give you a good place to start if you're thinking about in your state. But we can also share the Ohio and Colorado bills as well.
Awesome. Thank you. So everyone make sure to click that link and bookmark it so you can at least look at it
There's
later
the Colorado.
on. Oh, yep. Thank you, Jeremy, for that.
The Colorado bills in the chat. Thanks, Jeremy.
And then looks like we have our last question as of now. So folks, if you do have any last lingering questions for Susan or Pauline, definitely go ahead and put them in the chat box. But this one might be for either Pauline or Susan. So is not considering adding language to any bill to clean up telehealth, PPS, and other inconsistencies. Oh, I'll mute now.
So I would have to say I'm not exactly sure what you mean by clean up telehealth, PPS, and other inconsistencies. I think you would have to, I would need more specificity on that. But in terms of what I outlined before, yeah, the payment rate and other inconsistencies around that certainly, and then as well as yes, the distance site providers and home care and all of that. So I'm not sure if that exactly answers the question, but if we added it to any bill, yes, we would try to add it to obviously any package that moved forward in the House and Senate and that President Biden will sign. So yes, we will attach telehealth to anything we can attach it to. Thank you.
Awesome. Thank you. All right, so just giving a couple minutes just to see if there's any other questions that come in. Looks like you answered that question sufficiently, Joel says thank you. And so thank you everyone who has asked your questions. I really appreciate how detailed they've been in addition to the presentation that's been given. All right, so I'll keep.
Susan, I have a question before we move along, if you don't mind. One thing that we continue to hear about is obviously the importance of making these policies permanent, but then it would really be helpful to us if we had more information from you all about what that looks like. What does that mean for your patients? Are you going to, how will you use telehealth? I think post-pandemic is the question that folks want to really understand. So if I could just put it in plug, I think it would be helpful as Pauline and I and the rest of the team are thinking about how to best move this forward. Any information that you have, if you have data that shows the effectiveness of how you've used telehealth, if you have a story that you think is really compelling, the more of that we have, I think the better that we can turn that into action, hopefully, for you all, both the federal and at the state level. So if you have anything to share, you can send us an email, I think at our main email box here, and we will get that to the right folks. So thanks in advance for that.
Awesome. And what's that email address? Is it just state?
You could do it, yeah, state@nac.org would be great. I'll put that in the chat.
Thank you. Beat me to it. Awesome. All right, so just ending on that note, looks like we don't have any more questions. So I just wanted to pretty much wrap us up for this afternoon. And thank you all for attending, of course. But before we go, just reminding you, all of our archived COVID-19 resources are going to be found at nac.org. /coronavirus. And as you see, there's plenty of different resources we have included on this. And of course, we do have this growing online NaDoPod community. So if you would like to become a part of that, I believe it has partnerships between health centers, PCAs, and HCCNs. So it's definitely a space that you can share and pretty much catch up on any resources that may have been published recently. So if you would like to join that community, you would just email Susan Hanson, as you see at the bottom of that screen, fhanson@nac.org, and she'll make sure to get you connected. And then with that, I just want to, of course, just let you all know, we want to keep growing this group. We want to make sure we are staying relevant to what your organization is doing and pretty much what's going on within the telehealth space. So if you ever have a topic in mind, if you would like to be featured, if you have a best practice you would like to share, you can always email us at telehealth@nac.org. And of course, we'll make sure to schedule a time to coordinate prior to a call to really get everything scheduled and everything together and see if maybe there's even additional partnerships that can be made in between that. So I want to thank you all for your time this afternoon. Thank you for asking such great questions. Also want to thank my colleagues, Susan Sumrell and Pauline Jamry here at NAC for sharing this wealth of information with us. And looks like we're getting some good positive feedback from that as well. So definitely stay tuned. I'll make sure to be sending out all the resources we gathered today in an email, and I would try to get that out in the next hour. So make sure everyone has everything that they need. And if you don't, just feel free to email that telehealth@nac.org, and I'll make sure to get you connected. So with that, I'm going to end it out. Everyone have a great rest of your day. Stay safe and be well.